a baby or even considering it, listen to this. Sometimes you think you have it all planned out, but you forget one very important element: yourself. You got to make sure that you're talking to your doctor about ways to improve recovery, maintain a strong body, and manage postpartum pain. So, joining us to talk about it all is Dr. Marcy Crouch and distinguished anesthesiologist, Dr. Uma Shastri. Hello, doctors. Thank you so much for being here.
Thank you for having us.
No problem. Now, Dr. Crouch, help us understand how women can support their recovery after the baby is born.
Yeah, it's such a great question. Thank you for having us here so I can talk about it. There are so many things that women can do to help support their bodies after having a baby. And we really need to start to think about birth and postpartum like an athletic event. So we should be training for it like we're training for something like a marathon, and we should be recovering for it like we're recovering from a high-level athletic event. So lots of common things that happen but not normal to parents and moms after having a baby are leaking urine, chronic and acute pelvic pain, sexual dysfunction, pelvic organ prolapse, abdominal muscle separation, C-section, scar pain, and hypersensitivity. So really giving them resources, access to pelvic floor PT can be super helpful for them, and just making sure that we're rehabbing the mom appropriately from day one is so important for a successful postpartum recovery.
Absolutely. And, you know, speaking of recovery, Dr. Shastri, in terms of pain management, what should women be discussing with their doctors in preparation for that delivery, especially if they have a planned or unplanned C-section?
So all women, no matter how they deliver, whether vaginal or C-section, want to get home as soon as possible. Obviously, this is a little bit more complicated with a C-section as women have more pain. Yet C-section moms are still expected to feed their baby, hold their baby, get up, walk around, and look after themselves within the first 24 hours of surgery. A lot of times, especially with unplanned C-section, pain is primarily managed with opioids. Opioids come with a laundry list of side effects that can delay recovery: nausea, vomiting, constipation, drowsiness. So I encourage all moms early on in their pregnancy to talk to their doctors about non-opioid options for pain management, especially if they end up in a situation where they need a planned or unplanned C-section.
Now, what happens when, like you said, those opioids, sometimes it's difficult to ask for those. What if your doctor doesn't offer them?
Absolutely. I think a lot of times your doctor may not start the dialogue, but it's completely fair game for women to bring up the topic to their doctor and ask about various options. And usually I think women will find their doctors want to help them accomplish their goals. In terms of non-opioid specifically, there's a lot of options. I really like Exparel. It's a numbing medication that we inject into the surgical site after the baby's out and the surgery's done. It's a long-acting medicine that keeps the area numb for a few days. And usually with Exparel on board, patients need something minimal just to deal with the breakthrough pain, and we can avoid opioids altogether. They can learn more about exparel.com at exparel.com/safety. And yes, just once again to reiterate, just really bring it up to your doctor if your doctor doesn't bring it up to you.
I love that. I love when we can talk about women, you know, and people just in general taking control of their health and kind of insisting on having conversations or insisting on the doctor going one step further when they don't feel correctly or, you know, things like that. So thank you so much for that. And Dr. Crouch, what are the benefits of an opioid-free recovery after childbirth?
Yeah, such a great question. So I think there are a lot of benefits. Kind of the main ones that come to mind is that we really need to start to think about some of the side effects from opioids. And the most common ones are nausea, constipation, vomiting. And when we have sensitive tissues that just kind of went through a delivery or a major abdominal surgery, we want to try to decrease as many compounding factors that could prolong recovery or increase pain. And trying to push out a bowel movement on very sensitive tissue with stitches does not feel good. So we really want to try to provide women with as many resources and options as possible, like I said before, so they have proper recovery and comprehensive recovery from day one. So non-opioid type medications are a great way to do that, as well as pelvic floor physical therapy, and really kind of getting this great support team in place to help them through all of postpartum recovery, not just the first 6 weeks, but postpartum is forever. So they need these resources for a long time.
Yes, I love that. I love this conversation, helping women take care of ourselves after having a baby. You know, sometimes we get caught up in all the excitement and all of that, but I love having the conversation about putting the focus back on the mother. Dr. Crouch, where can people go for more information?
Yep, they can visit www.wearewomenshealth.com to learn more.
Thank you so much for being here. We really appreciate both of you.
Thank you for having us.
For having us.
No problem. Everyone, I want you to stay right there because we got more Good Day Live when we get back.